Hello and welcome to Chief Among Friends. I'm your host, Dr. Chris Hobson, Chief Medical Officer at Orion Health. On this podcast, I chat about topics ranging from technology priorities to new innovations in integrated and coordinated care to healthcare sustainability. You can follow the conversation on hashtag Chief Among Friends and be sure to follow me on Twitter at Dr. Chris Hobson. Today, I'd like to talk about a new concept that is the digital front door. I'm very excited to have my friend Andrea Tait with me. Andrea is a healthcare executive with 2 decades of experience in both the public and private sector and now serves as Orion Health's VP for Client Value. As such, a large part of her portfolio relates to value-based care initiatives and the search for solutions to deliver tangible value in improving healthcare. Orion Health is leveraging Andrea's experience in patient engagement to guide the strategy and delivery of our digital front door solution. In one of her standout experiences, she ran an Ontario-wide patient engagement initiative for community mental health and is leveraging that experience and more with the digital front door products. Today, we're going to learn about her work on the digital front door, developing a solution, and partnering with multiple clients internationally. Welcome, Andrea.
Thank you. It's nice to be with you, Chris.
Very good to be here with you too. So today's topic is the digital front door, and we're going to start with the future of healthcare and how that starts with the digital front door. So, Andrea, what is the digital front door? What are the components, and why should patients be interested?
So I think we'd start with some of the impetus for digital front doors. Different organizations, be they healthcare payers, healthcare providers, have different reasons for considering digital front doors. However, the consistent motivation is to increase their level of customer experience or patient experience. I think it's fair to say that healthcare has a customer experience problem. As an industry, we've not done well at managing a customer's experience, at mapping out the touch points and thinking about how to make that work better for our customers. It's been a very antiquated way of scheduling time, having people wait, having them move schedules, not being available when patients need us most. So the digital front door seeks to really take that and flip it on its head. If you think about it as a strategy for engaging patients at every touch point along their journey, and using technology as a platform to meet patients where they are. So becoming mobile so that patients can access their healthcare system on their phones is a key part of adapting our user experience or our customer experience to fit the way customers experience other things, whether it be online shopping or other online banking, things that they do in their everyday lives can really show us a better way to engage with patients or customers as a healthcare system. A well-done digital front door strategy is going to offer a health system, whether that's a payer or a provider, unprecedented efficiency and access. And it's going to give patients the kind of flexibility and convenience they've never experienced in healthcare before. It's a really different way to approach it than what you had traditionally thought about, where we call the doctor's office during business hours. They give us an appointment, a specific period of time out, and then we wait for the doctor to do follow-on referrals to specialists or other services we might need. So what are the components of a digital front door? That's an extensive list, and it really is a little bit dependent on the priorities of the organization implementing it. So digital front doors can include a lot of things. We've seen them include symptom checkers, so allowing patients to have a trusted place to go where they can put in some symptoms and get most likely diagnoses for those symptoms a navigator that allows them to then seek services themselves that are most appropriate. So whether those services are mental health and addictions or community support services, those services can all be put literally at patients' fingertips without having to wait for some administrative part of a doctor's office to schedule those services for them. The other thing that is key is to put an appointment scheduler and allow patients to automatically schedule appointments with various providers at their convenience. So being able to see what's available to them, being able to see how close those providers are to home, and make the best decisions for their schedule and their lives is a really fundamental shift in the way we think about making appointments available to patients. And then thinking about wellness support groups. We have clients at Orion Health who think about what kinds of supports can we put in place to help our population manage their health. So thinking about making smoking cessation groups available, or weight management groups, or exercise communities, or communities around specific illnesses available, along with things like a vetted list of health readings so that they can get vetted and trusted resources that tell them more about their own condition. Those are things that we've never really done in a holistic way before as health service providers, and they make a big difference to the way patients engage with health service providers, but also become part of their own care team. I think that's a really key part of what a digital front door has the ability to do. Different than just giving a patient access to their own health information, it's really about empowering patients to become part of their own care teams and their families, of course. The other things that we think about are disease management tools and helping people with things like medication reminders. And these kinds of things can help people maintain wellness, help people manage chronic disease better, and reduce the adverse outcomes that we see, especially in single payer systems, but even in multi-payer systems. We can reduce adverse events by putting these tools online, making them available to clinicians as well, or making their outputs available to clinicians as well. Patients become an integrated part of their own care teams, and together, clinicians and patients can more actively manage their own wellness. We talked a little bit about access to health information. One of the big things that we see happening is making a really trusted source of current and geographically appropriate health information available to patients and customers. That's so key because it really lets people empower themselves with more information and make good informed decisions without falling victim to a lot of misinformation that can be available with sort of general Google searches. The other thing that we think a lot about is how can we meet patients where they are when they need our support? So we see the extension of digital front doors to include things like call centers that have some clinician advice component to it, whether they're nurses or nurse specialists, virtual walk-in clinics that are staffed with physicians, so that we can have access to our healthcare systems when we need it without going to an emergency department, waiting for hours, especially in an area of in the era of a pandemic like COVID. You know, this keeps people home, it keeps them secure, but still gives them access to maybe ask a question of a clinician in the middle of the night, and then make a decision to schedule an appointment within 24 hours, or do a virtual consult with a clinician and get some advice on whether they have to go to an emergency department or whether their condition can wait and be treated virtually instead of physically having them go to a location. So that's a radically different approach from what we've seen before. We're starting to see this happen. We're seeing things like virtual emergency departments, virtual walk-in clinics, 24/7 clinician staffed call centers that help people make the best decisions for their health, but meet them where they are and deliver that care in a way that's much more comfortable for people. Overall, virtual care experiences get wildly good feedback from most patients. And so we know that although we weren't always certain that we could deliver care virtually, there are many cases where that makes sense and is actually a better solution for patients. So in a nutshell, that's some of the components that are available in a digital front door. And really the key here is to think, what are the priorities for my customers, my patients, my organization, and then use the tools available to you within a digital front door strategy to tackle those priorities, and then broaden out to other tools once those are implemented and being adopted.
So this is very interesting, and you've definitely got my attention. One, at a certain level, though, we've been talking about patient empowerment and patient engagement, as long as I've been in healthcare, which is a long time. So the question is, so why do you think now these calls for patient engagement and more active participation have kind of coalesced around the need or the requirement, belief that a digital front door is the answer? Why do you think that is happening now?
So I think there are a few components to that. And the obvious one that we shouldn't discount is COVID-19, a global pandemic that has pushed many organizations as well as patients to a more virtual approach to healthcare, and has gotten a whole range of both clinicians and organizations and patients to use virtual solutions and to, frankly, see their value. So nothing like sort of having that experience and finding it go fairly well to think, okay, this is something that we could potentially use. So COVID has definitely, I wouldn't say it's been the only contributing factor. It's definitely been an accelerator. The other thing, though, that we need to think about is the state of healthcare in general. So we know that we have a growing age population with more complex diseases and many times multiple chronic diseases that they're managing at the same time. The challenge with a more traditional way, exclusively traditional way of delivering healthcare is that there is no way to grapple with the increasing cost, the increasing pull on resources, and the lack of availability in some case of those resources. So I think, as a digital front door has been a way to grapple with some of that as well. And we see instances where organizations or regions are looking to do things like decrease emergency department admissions by a certain percentage, 10% or 20%, by using these kinds of technologies. And what that really does is certainly decrease wait times in emergency departments, but also it decreases the cost of delivering those emergent services. And that's a key component of keeping our healthcare systems funded and healthy as we grapple with these growing challenges around an aging population and multiple comorbidities. So I think that's another thing that has pushed us towards digital front door. And then I think another big component of that is, as I said earlier, healthcare has a patient experience problem. And as we get more people who are technology savvy, who use technology in all of their regular lives, demanding a better experience from their healthcare providers, patients are really pushing us to say, find a better way to do some of these things, find a better way to do standard medication renewals, because the way I'm doing it now is inefficient. And so the other big push is from patients and clinicians. Many clinicians who are saying, these standard things that are part of my healthcare day, I can do these more efficiently through a virtual experience, or my patients can engage with me through a digital front door in a way that's more efficient for them and more cost effective for me. And so those kinds of things are really pushing us to what I think is a fundamental disruption of the way we engage with patients and deliver healthcare.
So just to reflect, as a patient, I recently spent a week going back and forward to the pharmacy for a simple medication refill. And at the end of the third visit, I finally figured out they were faxing the wrong doctor. So this is just such a waste of time. And I think it'd be very exciting to see something like this evolving from a patient perspective.
Well, can you imagine going to your bank and being told that the reason that your mortgage renewal hadn't gone through is because they faxed the wrong place 3 times?
Exactly.
It would just not be acceptable to us, right? To have
simply unacceptable.
Right. So I think patients like us or customers like us have said, we know there's a better way to do this. We experience this in all these other different facets of our lives, and we are simply not going to accept that's the way we do it anymore. We've been having discussions about getting rid of faxes in healthcare through my entire career.
Exactly.
So, when I talk about healthcare disruption and people get worried about the word disruption when used with healthcare, I point to the facts and say it can't get any worse than that.
I completely agree. So there is the patient empowerment, patient engagement, all of the good things we're talking about. If we're going to manage chronic disease and some of these other things, so I take it that the digital front door will be integrated with the rest of the medical record, or perhaps with a provincial EHR or a statewide HIE?
Yeah, that's a really key component. Is patients have long wanted access to their health information and that of their families. So we have to think about families, access to your children's health information, access to an aging parent's health information, whose healthcare planning you assist with. I mean, those things have been long-standing requests. The challenge is that the way we do it now often fragments patients' access to that information. So healthcare portals in hospitals, for example, give patients access to some of their information, but not all of it. And that can be frustrating too, because a single result from a lab doesn't tell us the story that we need to understand for managing a chronic disease. As an example, we really need a range of results over time to be effective in understanding what those results mean. So I think your point about integration of medical records and complete comprehensive medical records, like the ones we find in electronic health records or HIEs, is a really big component of this. What we don't want to do is fragment patients or a customer's experience by asking them to go to multiple places to get this information. And the other thing we want to do is make sure it's as complete as possible, because that gives them the best possible chance to be empowered, to be able to act on that information, to be able to discuss that information with their healthcare providers. So I think that integration of a medical record or HIE is key. And I think it's part of why I joined Orion Health, and I'm excited about Orion Health's role in this disruption of the digital health market. If you think about it, 20 years ago, Orion was a disruptor. Orion came in when HIEs or integrated health records were not the norm, and was an early leading and market predominator for deploying HIEs and EHRs across the world. My belief is that Orion can be that now for digital front door, again, because we have 2 decades of managing health information, because we understand how to integrate health information, and because we understand how to do the other components of what an HIE does. I think the other big thing to think about from an HIE perspective is privacy and security. So thinking about using organizations or working with providers and vendors who have broad experience that is healthcare specific, and privacy and security is a really big component of this.
Certainly, I think if the digital front door can help us, one of the clear problems we have from a patient perspective is fragmentation of that patient record. And if you're seeing multiple different providers and each one has a patient portal, next thing you know, you're trying to go in and out of multiple systems as a patient. And I've heard patients complain about that as well. So
yeah,
this is good if it pulls that together.
Again, imagine if your bank told you to go to 5 different
portals.
sites, 5 different portals, depending on whether you wanted to talk about your mortgage or your line of credit or your checking account or your saving account. I mean, you would fundamentally reject that experience. But in healthcare, we regularly tell patients that that's what they should do. So, I agree that integrated approach. And the other thing is allowing patients to share that information is key. We can use circle of care tools to say, add my husband to this circle of care so that he can see my information, or add my mom can add me to her circle of care so that I can see her health information. Or I can add a specialist that I've just been referred to, or a community mental health provider that I'm working with, so that I can make a choice about other providers seeing all my health information. And who among us hasn't had an experience where you get referred to a healthcare provider who orders a bunch of tests that you just had again because they don't have access to that information?
Absolutely. So we've talked a little bit about COVID-19 and things like the push to do more healthcare virtually, and the understanding now that not all healthcare can be done in hospitals because we'll overload them. Not every patient with COVID needs to be in a hospital, that we need to be able to provide that care in the community. So I wondered, just focusing specifically on COVID-19 and management of COVID-19, how does the digital front door help and fit in with the whole COVID-19 pandemic?
Yeah, I think it's a really good topic of discussion. So, but it also plays out to the more general disease management discussion. So certainly COVID is one of those things. For example, if I have a solution in my region, and we do here in Ontario, where we can deliver test results for COVID-19 electronically, integrating that into your digital front door, so it's not a separate solution in a separate place with just COVID-19 results, means that people can check on testing. Then imagine if we integrated an existing vaccination solution or vaccine booking solution, so people could get test results and make appointments for vaccine when it's appropriate. And then think about if they could check symptoms in that same place with a symptom checker that already exists that's just integrated into the digital front door. And let's say that we have somebody who is positive for COVID-19. A digital front door allows them to do things like check their oxygen levels and report those in the digital front door as part of a chronic disease management strategy. So now they are working with healthcare providers to monitor their own health. They can go in and speak to a nurse in a virtual care clinic if they're concerned about something, and get an assessment from a healthcare professional about what their next steps might be. This is going to help us more effectively manage people where they are in their homes, and have the correct people routed to hospital or emergency department, but keep the people who don't need to be there managed and treated at home. And if you think about COVID-19 and the challenge we're having right now, that's a significant one. But if you think generally about other diseases, the pattern is very much the same. So if I'm a diabetic who's working with an ambulatory diabetes clinic to control things like blood sugar and A1Cs, I can take a measurement every day. It can be part of my digital front door patient file. I can give access to the nurse working with me in the ambulatory diabetes clinic. And then I can do virtual consults with them to talk about the things that are going well. I can keep a food diary. The nurse can assess that. The level that we empower people to work with their healthcare providers and really, without going to hospital, more actively manage these conditions is really significant. And to me, it's one of the biggest places that we can save money, be more responsive to patients, and position ourselves to take better care of the people who are in hospital and need to be there, because we don't have the people who don't need to be there.
So I agree. It seems a very logical and way to tackle what's otherwise a very difficult problem. With the COVID-19, one of the things that occurs to me is that it has shown, although people of all walks of life and all socioeconomic situations can be impacted by COVID, it is to some extent a reality that people in overcrowded conditions, people of colour, people marginalised, that they have suffered more with the COVID-19 crisis than perhaps other people who are able to work from home, don't have to interact with many members of the public and so on. So this brings us to the topic of the social determinants of health and health equity. The only thing that occurs to me is, so if I'm in a marginalised situation, am I going to be able to access the digital front door? What is the interaction between the digital front door and addressing problems of health equity?
That's such a great question. And I mean, certainly health equity has many components to it. Access to technology is one of those components. So what we're seeing in many regions is, there is the phone-based application, there is a web-based application. There's also a call center. So just anywhere that you can call a standard number from. There are tools like human avatars or digital humans that we use to help people who are less technology savvy interact with the digital front door in a way that feels more appropriate or easier for them. But then there's also ways to think about being culturally sensitive and appropriate with digital front doors. We can, depending on the community that you come from and the way that you would like to engage with the healthcare system, digital front doors can help us be more effective in that. So we can build in, for example, in Canada, we spend time thinking about how to build in culturally appropriate approaches to wellness for our Aboriginal populations. Well, digital front doors allow us to do that. We can build in other approaches to wellness that include components that that Aboriginal populations use as part of their approach to wellness management and make that experience better for them. We also can use social determinants of health characteristics to have a better patient experience and to guide reach out to patients in areas where they might be, where there might not be as much ability to interact. So thinking about putting kiosks in places like supermarkets and pharmacies and community centers where there are pharmacy deserts can help us to deal with the inequalities that are built into, especially bricks and mortar access to healthcare systems. So I think it's a huge topic. there's a lot of work to do on this, but the tools are there to be better at it than we currently are. And the other things that digital front doors give us is the ability to really analyze what we're getting right and what we're getting wrong, and then to adapt our approach according to those things. So that would include health equity, access, cultural appropriateness. We can analyze using artificial intelligence or analytics tools how we're doing, and we can adjust our approach or learn from what we did well and what we did less well to continually make that experience better. And that's something that isn't something we do well in our traditional approach to healthcare delivery and measurement.
So certainly, Andrea, you've convinced me that the digital front door is a highly valuable tool that, although it has roots in a lot of things that we've been talking about before, things like patient engagement, disease management, patient empowerment, even COVID-19, it feels like a very exciting strategy for pulling different elements together and provide a unified experience to the patient. So, as I say, I think you've definitely convinced me that this is a really important and valuable next step for the healthcare system.
I think I want to leave you with one other thought.
Yes, please.
So I definitely think that this is valuable. I would go so far as to say a necessary disruption to the healthcare system and the way we deliver healthcare. And disruption is always change, and change can be concerning. What I would say is there are components of some of the solutions out there already. So many regions, providers have virtual care systems, as an example, virtual care tools. Some of those organizations have referral networks, digital referral networks already in place. I think one philosophy that has guided Orion's approach to this was don't rip and replace. So think about the tools that you already have in place. It is difficult to implement change, and it takes a long time. So where you have adopted tools, where you have people using virtual care solutions already, e-referral solutions already, those kinds of solutions should be maintained. And then a good digital front door strategy just brings all of those solutions together. It doesn't seek to throw them out and replace them with a new one that is part of the quote unquote digital front door product. And that's been a key governing philosophy here at Orion Health. Keep what you have and integrate it as part of a digital front door experience that's seamless. Don't start at zero, because it will take you too long to get through the early stages of change. And that's where inertia lives. And that's where it can be difficult to get adoption and drive through to the next phase. So give yourself a leg up, and do that by using the tools you already have, and then work with a company to integrate those tools together so that the patient experience is seamless, the clinician experience is seamless, but nobody has to throw at all their existing tools.
Thank you so much, Andrea. That's been a very interesting discussion. Thank you for being on Chief Among Friends. Thank you to the audience for joining me today on Chief Among Friends. For more information, don't hesitate to contact me on Twitter at Dr. Chris Hobson, on LinkedIn, or visit our website at www.orionhealth.com.